for a small period of time. But for your industry to make the spurious allegations about the McGuinty government reducing frontline healthcare services is just simply untrue. It's reprehensible, and it doesn't do your case any good at all.
This is the Freedom of Information Order, and this is the invoices with the dates, with the amount the government received. Is this bad? No, it's not bad. This helps.
Ben, could you explain what this is?
This is basically, there was Freedom of Information.
By whom?
Request was done asking for some details about the money the government is getting from the brand name companies, which is representing about 75% of the total budget.
And what is that money for?
This money for listing. So basically the government
for the drug
say,
part.
yeah, I would say, okay, we list your product, and in return we have an agreement with you, you pay us that much percentage of money back.
And Ben, what would you think the government does with that money?
We agreed.
We don't know.
We agreed that
we don't know what you're doing.
Could you tell us?
Gentlemen, we agreed that we will not interrupt each other, and I respect that and I acknowledge that. Is this bad? As a taxpayer money, I encourage the government to do that because this is money coming to the system. I have no problem with it.
That's exactly right.
My only problem with this is one thing. By taking this money behind the doors, it's good for me as a taxpayer money. That's fine. But you do not force the brand name to reduce their prices, so the end result is the third-party payers, people working for companies, and they pay for their own insurance, the prices for them for the brand name is still high. People are paying out of pocket for the brand name is still high. So this is against your own argument by making it available to people.
So Ben, you make a very good point. And I think the answer is, if it turns out that the next phase of the government's responsibility is to look at the cost of brand name drugs, let's work together on that. But to suggest that somehow the government has got a secret revenue source from the pharmaceutical companies, and we do something magical with the money, we put about $45 billion into healthcare every year. The fastest growing area in healthcare is in the Ontario drug programs.
Yes.
We have a responsibility. We have a responsibility on behalf of taxpayers around the province, on behalf of families around the province, to get under control the escalating cost of drugs in this province. And that's all that's going on.
I did not say that the government is doing anything bad with this money, or I did not.
No, but you
really
did use the term kickback, and you did make it look like it's a secret fund.
Exactly. That's exactly
and
my
that's
point.
what I think that...
That's exactly my point, because the government is using the professional allowance, which was legislated by the McGuinty government, against us as a kickback. Are we supporting the professional allowance or the kickback system? No, we're not. Are we supporting reduction of prices of generic and the brand?
Yeah.
No, we're not.
For that.
No, we're not. On the other hand, we would like to be paid, and I think everybody will agree that, fairly for the service we provide. We are doing service, and we would like to be paid fairly for the service.
Ben, okay, let me just answer that. I agree with you that you should be paid fairly for the service. And you know, and the audience should know, that this new system is going to result in higher dispensing fees, is going to result in payment for services to patients, and some of it will reduce the burden on government of the overall program. But the fact is that the industry, your industry, must be doing very, very well. We wouldn't have all of these drugstores. We wouldn't have pharmacists working in every corner of the province if it wasn't a very profitable...
I've got to wrap it up. 1 second, Jim, all of you.
You need to do a commercial.
We're going to be right back after this break, and we're going to take a look at Business 101 in pharmacy. Let's get inside this business model. Join us in a moment. Welcome back to Focal Point. Tonight we're actually taking an in-depth look at what the Ontario government's done recently to help reduce the ever-growing cost of drugs. It is a big cost. What we were talking about earlier in the show, before the break was the fact that nearly, oh my goodness, is this a real number, guys? It says here the amount of money that's been increased from Ontario's support of pharmacies it's increased by $318 million, or nearly 50% since 2003. So there's a lot of money. Before the show, the break, we were talking about the business model, and I think maybe that's something the public needs to hear, because we think of healthcare as a not-for-profit model, but as Greg Sorbara was saying, obviously there's has been a profitable business. It's a big business in Ontario and in Canada, and maybe among the three of you could help us understand how you serve the public through this business model called the pharmacy.
Well, Nancy, I want to address that, and I take exception.
Before you start, can I just come back to a point Greg mentioned, and I take it really personal, that there's too many pharmacies here, more than Tim Hortons in Canada. I can tell you, so what? And I can add as well, we have Mr. Loop all over Canada, 100 stores. We have MPPs in the Legislative House, 107. So what? What's the relation between this and that?
Let me just try and explain that then. The point I was trying to make, look, I'm not a fan of Tim Hortons. I'm trying to put it in perspective that in Ontario, Nancy mentioned the increase, the hundreds of millions of dollars increase that Ontario taxpayers are putting into the system. And that system flows through your hands. We are really well served by pharmacists and drugstores right across the province, in urban areas, in rural areas, in northern areas. Every corner. Now, let me
what's the number for that, Greg?
Let me just
What's the number for that?
We are very well served.
How do you know that? What's the number for that?
The industry is very profitable. The fact is that...
Do you claim that by saying a Shoppers Drug Mart statement?
I mean, what does
One
this mean?
segment of the marketplace?
What does this mean? As a government, you cannot come and just force changes because you believe that we are profitable. You have to have what's called impact study.
Well,
and to say, if I do this, this is the profitability of the business model I'm going to affect. And if this was to be implemented, this business model will stay.
I am the first one to admit that these reforms on behalf of Ontario taxpayers to reduce the cost of generic drugs is going to have a financial impact on your store, on your store, and on your store, and on every store. The fact is, the studies that we've done show that that impact will be temporary, and with the new supports that will go in to support pharmacists and pharmacies, and the increasing volumes which will come about because this will allow more drugs to go on to the formulary and more availability to Ontarians, it will improve access for patients, for Ontarians, right across the province. Now, the fact is that, yes, your bottom line is going to be effective. I'm sorry to hear that.
Why is that?
It's something that we have to do.
That's my question to you. Why is that? Why my bottom line will be affected with this reform?
Because our bottom line...
Can you explain to me, if you already have done the study, why my bottom line as a pharmacist will be affected by a reduction of prices of generic?
Because the professional allowances that you receive from generic drug companies will no longer be permitted. It was permitted from 2006 until these reforms. After these reforms come into place, it will no longer be permitted. And that means less money to you and your pharmacy temporarily.
No, in my mind, it will be that you are taking the indirect funding coming from professional allowance, and you as a government do not want to pay direct funding.
Exactly.
So that's the key issue here. For 21 years, the Ontario government underfunded the pharmacy service in Ontario. The proof to that?
That's startling. That is startling.
The proof to that?
You've increased our fees by 56 cents in 20 years.
In 20 years.
Yet politician salaries have increased 160% in the same time frame.
Okay, can I just say something before this gets personal, and for anybody watching the show who just wants to know, just who wants to know what's the cost of drugs and my pharmacy going to close. It says in 2006 the government did begin to rein in the cost of generic drugs and expand patient access to medicines. what everybody wants. Since that time, this government has reinvested over $1 billion and added 150 new prescription drugs to the formulary. 38 of those are cancer drugs. The Ontario Cancer people have spoken out. CARP has spoken out, representing the seniors. The Ontario Federation of Labour has spoken out. This is not just